I have been a nurse at Delray for 10 years. I'm currently working in the trauma unit there. I've been there for 8 years, but I worked in their emergency room for 2 years prior to that. There wasn't anything in my life specifically that made me want to become a nurse. I've just known since I was a little girl. I wanted to become a nurse because I like to be able to help people in their time of need. It's a very rewarding experience to be able to help somebody that needs your help. So I take care of trauma patients as they come into the door. We're at the bedside asking the patient questions, trying to figure out what their injuries are. We do the x-rays, get them to CAT scan. When we come back, we figure out if they need to go to the operating room or if they just need to be admitted and be taken upstairs to either trauma ICU or trauma step down. I work with a bunch of other nurses and physicians, and we all work together to try and figure out what needs to be done for that patient. Caring, being kind, supportive not only to the patients but the families, being educators, being the patient's advocator because sometimes they cannot speak for themselves, and be there for the families as well. It's not just the patient you're taking care of their families as well. Being able to see these patients go home with their families, know that you did something that made them get better so they could be able to leave the hospital with their family.
You actually save lives.
I do, sometimes.